So what I showed here in these oral communications looks like the same here. We select some case. So it's combination of ultrasound and MRI for virtual reality systems to evaluate fetal malformations. So what you see here is a fetus with Down syndrome. So the reconstruction by ultrasound. And here, the same reconstruction by MRI. So I select some case, 12 cases, some of them with chromosome malformations, other with other malformations. So, but I would like to show you here, you see here this case. It's 3D from ultrasound and the 3D from MRI. So what do you do here? This fetus has an omphalocele and a genus of the radio. And we mixture the informations, and you have here the clean image that you can use this image. How you use this image? In the example here, we can reconstruct. Here you have the reconstruction in Chiari tumor malformation by MRI. So I can reconstruct the model, and I can navigate inside. It's the way to student and professionals see in 360 degrees. So you put the glasses, it's the same as you are inside the uterus. So you can navigate, you can see around, and you can see everything. So how you do it? The process is, part of the process is manual, so sometimes take time. If you have a lot of amniotic fluid, the process is fast. Otherwise, you have to clean, like I'm doing here. After we finish all the segmentation, we prepare for navigation. So here we have a case of lymphangioma that we prepare the airway path, and you can see here clear the invasion of the lymphangioma in the airway path. So we prepare the 3D, you organize here uterus, umbilical cord, placenta, and fetus, and then you can do the navigations. Here I show another case. It's a fetus with teratoma. We reconstruct all of these, ultrasound, MRI. You have all the views, and the surgeons receive these in the cell phone and the tablet. All the discussions can be with this or with virtual reality, like I'm doing here. And here you have the relation between the tumor, teratoma here, and the airway path. So it's another didactic way to see it, but you can see, as I'm doing here, in 360 degrees using the virtual reality device. So here, another example, you see in the ultrasound, you see the fetal face, front and profile. You see how ultrasound seems the postnatal here. We reconstruct also using the MRI information, so both exams are doing it at the same day, and then you have the segmentations and using parts coming from ultrasound and MRI, and you can prepare the device and navigate. So we prepare case for students to study. So it's the same, ultrasound and MRI, they give nice, very nice images and volumes. We can use all of this and work more on this to prepare different views for students and multidisciplinary team. It can be used for education purpose, visualize, better visualization for parents, and images can be segmented and applied on virtual reality immersive technologies. Thank you very much.
Other questions? Thank you very much for a very nice presentation. Please, go ahead.
Thank you very much for your work.
Thank you.
The 3D images of a big baby, how do you get these images?
Yes.
Like 2D, the MRIs?
Yeah, that's the limit of the ultrasound, just why I use MRI. So in MRI, you have a big field of view, and you can have the whole image until 39 weeks, 40 weeks. So what we do the MRI. We use a sequence, isotropic sequence that you can have the whole 3D information. The slice should not have more than 1.4 millimeters to have a good reconstruction. But when I reconstruct the airway path, for example, the slice cannot have more than 1 millimeter. So we use the MRI. In small fetus, you will use just ultrasound.
Thank you.
Any more question?
I have a quick question.
Yeah.
How do you manage to perform the registration between the ultrasound and the MRI images? The registration
At the
between...
registration, we have a software. We have the polygons that you speak, it takes some small pieces from the ultrasound and put in MRI. So just small, but the quality of MRI now is getting better and better and better. That as past the time, I use less this. Yeah. I used much more before. Yeah.
You have one more question?
Thank you. Probably I didn't understood completely, but so you take the ultrasound images and the MRI images, and you delineate by hand all the organs?
Yeah.
And then overlapping the two images, ultrasound and MRI?
Yeah, we have software for this. So what we do is the segment, for example, a big fetus, we segmentate all the images in MRI. So, for example, 1 ear I cannot see because it's difficult or the image was not very good in MRI. I can look for this information in ultrasound. But as I told you, the quality of MRI, of the reconstructions, and the quality of these slices is getting better and better. And as much I have this, I use less ultrasound in big fetus. But we have this possibility to put the image together.
But at the end, it is a manual delineation.
Yeah, we have software. We have software. We have to study all the points, polygons, and then to not disturb the image, because otherwise you lose the quality. And then you have software to put together.
And how long does it take?
Depends of the case. Some case, when you have a lot of amniotic fluid, the quality, the good volume of amniotic fluid is you don't lose time. It's faster. But sometimes it's less amniotic fluid. You have umbilical cord close by, placenta close by. So sometimes it can take hours.
Thank you.
Thank you very much.
Thank you very much.
We are very much looking forward to the further progress of your
Okay, thank you very
method.
much.
Thank you.
Thank you.